Welcome to this special edition of The Point with me, Liu Xin. On June the 7th, 2020, China released a white paper titled Fighting COVID-19, China in Action. It explains in details the country's battle against the disease, which has infected over 7 million people, killing over 400,000 so far. When was the disease first reported in China? How did scientists figure out the medical mystery? And how fast did China inform the world, including the United States? I visited the Chinese Center for Disease Control and Prevention, located north of Beijing. It's directly under China's highest national health authority and function as the brain behind its COVID-19 response. I had the privilege to talk to its chief epidemiologist, Dr. Zunyou, and became the first journalist since the outbreak started to get an inside peek of the facility. In 2 episodes, we are going to show you what I've learned and seen there. But first, let's go back to late 2019 when an unknown illness started circulating in Wuhan. On December 27th, Dr. Zhang Jixian from a local hospital reported the cases to the Center for Disease Prevention and Control of Wuhan, Jianghan District. The city government arranged for experts to look into the cases, concluding that they were cases of a viral pneumonia. On December 31st, the National Health Commission, or NHC, the country's highest health authority, sent a working group and expert team, including members from the China CDC, to Wuhan. Meanwhile, the city's health commission confirmed 27 cases and urged the public to stay away from crowds. On January the 1st, 2020, the NHC set up a group to lead the response. The next day, the China CDC, together with other institutions, received the first batch of samples of the virus and began the pathogen identification process. On January the 3rd, the Wuhan City Health Commission reported a total of 44 cases. Meanwhile, parallel laboratory testing of the samples continue. Also from that day on, China regularly updated the World Health Organization and the rest of the world on the development of the disease. On January the 4th, the head of the China CDC called the director of the US CDC, briefing him about the disease, the cause of which was still unknown. The 2 sides agreed to keep in close contact. On January the 5th, the Wuhan City Health Authorities updated information on its website, reporting a total of 59 cases of the viral pneumonia of unknown cause. China also sent a situation update to the World Health Organization. On January the 7th, Chinese President Xi Jinping became personally involved and issued instructions on the prevention and control of a possible epidemic. On the same day, the China CDC succeeded in isolating the first novel coronavirus strain. On January the 8th, experts designated by the National Health Commission initially identified a new coronavirus as the cause of the disease. The heads of the China and US CDCs held another telephone discussion on technical exchanges and cooperation. On January the 9th, the NHC released information on their preliminary judgment and updated the WHO. The WHO released a statement noting that the preliminary identification of a novel coronavirus in such a short period of time was a notable achievement. Then, on January the 12th, the NHC submitted to the WHO the genome sequence of the virus, which was then shared globally. On January the 13th, the WHO announced cases had been discovered outside China, in Thailand, adding that China's sharing of the genome sequence enabled more countries to quickly diagnose patients. On January the 14th, the NHC held a national teleconference on the disease. It announced emergency preparations and response across the country. The NHC cautioned that there was great uncertainty and that more research was needed to understand its mode of transmission and the risk of human-to-human transmissibility. Further spread could not be ruled out. On January the 18th and 19th, the NHC assembled another team of experts to Wuhan. In the middle of the night of the 19th, the team determined that the new coronavirus was spreading between humans. On January the 20th, the NHC held a press conference during which experts confirmed that the virus could transmit from human to human. 3 days later, on January the 23rd, Wuhan was locked down.
这个去不了了，全部取消了。
今天早上我是看到整个武汉市都公交车、地铁全部封城了。
当前要继续集中力量抓好湖北省，尤其是武汉市疫情防控。
害怕，说不害怕是假的。
然后一量那个体温37.5，我说完蛋了。
不要以为武汉人都犯病了。
生命太脆弱。
我来了，我一定要活着出去。
这两天，来自上海、浙江、海南、江西的医疗队先后出发。
我觉得我的城市并没有停下来，只是它的脚步很慢而已。
但如果我们不去，它其实呢？
只要希望不在，那么之前的所有这些都不会存在。
Dr. Wu, thank you very much for accepting our interview. So the province of Hubei, especially the city of Wuhan, reported the first cases of unknown pneumonia back then on 27th of December. On 29th of December, they reported more cases. But it still took a couple of days for the China CDC to take action. According to the latest white paper, the China CDC sent a working group and an expert team to Wuhan on December the 31st. Why did it take a couple of days for the CDC to send these groups, and who went there? What did they do?
First, I think for the pneumonia, unknown etiology, it takes time to make an initial assessment. So the first doctor reported a few cases. That does not mean epidemic. So the local public health officials make an assessment, collect more information about the cases, the number of cases, and the range of the epidemic possible. So that takes time.
So, as I said, the China CDC sent a working group and an expert team on December the 31st. What's the difference between these two?
Right, that's the same group. Actually, it's combined by public health officials and experts. The experts consist by the virologist and epidemiologist. They need to make a joint assessment.
What did they do? How long did they spend in Wuhan?
I think the first look at is cases. It's this how is the case distributed, and is there potential outbreak. So that initial assessment is very important. So I think in the first day they collected data about exposure. Most of the cases have a common exposure to Huanan seafood market. Then they made a decision. Next day the Huanan seafood market was closed.
So according to the BBC, on December the 31st, Chinese officials confirmed that they're investigating 27 cases of viral pneumonia and dispatched a team of health experts to the region. Authorities say 7 are in a critical condition, yet no human-to-human transmission has been identified. Was this correct, that after the first group of experts been to Wuhan, they came back and they said no human-to-human transmission?
At the initial stage, they do not have evidence to approve their transmission mode. So they do not know where it comes from, how that is spread. So at the initial stage, they do not have data about the transmission.
Is that why the CDC, under the guidance of China's national health authorities, sent a second or participated in the second national experts team to Wuhan on the 8th of January and then the third on the 18th of January?
That's correct. I think the investigation ongoing. It's jointly by the local experts and the national experts. Even the experts at the central government is not there. They still have the communication by the modern technology like email or the telephone. The ongoing communication still there.
It's been highly criticized or scrutinized on the Chinese, among the Chinese general public. They're saying, how come the experts, the epidemiologists, for instance, they go to Wuhan for 3 times, and it only happened after the 3rd time that they were able to say that for sure there was human-to-human transmission. How come it took so long, you know, from December the 31st to the 20th of January? It's still 20 more days.
It is very complicated to make the decision, the transmission mode. It's critical. It's not easy to collect epidemiological data.
But you were on the ground. I mean, the doctors were on the ground. Why was it so difficult? And you came from the National Health Commission, you came from the CDC, national experts. How come you were not able to go into the hospital and collect data?
So going to the hospital collecting data, you need to recreate the transmission chain, how people get infected, how they're transmitted. That takes time. Also, the distribution, the evidence, you still need to from a different perspective. I think the first solid data, it's from the transmission among travelers from Guangdong. That family infected, then one of family did not go to Wuhan, get infected. That is direct evidence for person-to-person transmission. In the Wuhan, it's very difficult. Even doctor get infected, they may get infection from a patient. They may also have visited the Huanan seafood market, the common source of infection. So we need to collect diverse data, triangulate, making sure the finding or the conclusion was scientific valid.
Well, there is a difference between saying there is no human-to-human transmission and there is a possibility of human-to-human transmission. We just don't know. According to this BBC report, for instance, they're saying that yet no human-to-human transmission has been identified. What was exactly the conclusion of the CDC after the first 2 experts' mission?
If we look at the statement, not identified, does not mean there's no human-to-human transmission. So we need to collect more evidence, more data to verify. So that is only to that stage, the evidence not good enough to make that decision yet.
But what was the possibility? Because I was talking to the first doctor, Dr. Zhang Jixian. She was the one who reported the first cases, and she was suspecting some human-to-human transmission because the first 3 cases came from the same family. So she suspected there could be some kind of human-to-human transmission. Was that not enough evidence to give suspicion to the possibility of human-to-human transmission?
Suspicion is a suspicion. It's based on her prior knowledge. So her prior knowledge about SARS, that do have a person-to-person transmission. This is unknown at that time, unknown pneumonia, unknown pathology. That does not mean you have evidence. So finally, make a statement of person-to-person transmission. You must have solid evidence to approve.
The National Health Commission sent 3 groups of experts, but there are 7 days and 9 days in between. So first on December 31st, and then January 8th, and then January the 18th. Could the time interval be shorter so that, you know, earlier people could make a decision whether it was for sure human-to-human transmissible?
No, it still takes time because for the epidemiological investigation, you need to go to case by case. Each case takes a few hours, some maybe half days. Record the previous day's activity is not easy. The second is virologists try to isolate the etiology pathogen for this pneumonia. So all that take time.
Well, according to media reports, one member of the second expert team, he was anonymous, he said after the second team arrived in Wuhan, a lot of the information they simply couldn't get access to. For instance, there was no official report where the disease came from, how it was discovered, what kind of investigation, what was the results of the investigation, how many cases, so on and so forth. But according to my understanding, my interview with Dr. Zhang, she had some understanding of these initial cases. For instance, they had contact, they came from the same family, they were ill, since how long, and they had various symptoms, different symptoms, but some of them had the same symptom, which is lesions in the lung. So there was certain information. Exactly where was the information getting lost? Did you ever think about that? Has the CDC thought about that?
I think the investigation do have the access to this data. They do. I think the issue is the limited data is not good enough to make the final decision person-to-person transmission in the very, very early stage. And also for this, unknown pneumonia has not been listed in the notifiable disease yet. So our limited understanding in the early stage is very limited. So
there have also been criticism of how the local government was not updating the public timely, especially during a very critical period of time when they were having a very important local meeting. When CDC experts were doing their work on the ground, was there any non-cooperation? Was there any intention that you or your experts, your colleagues, detected that were not helping them actively to find out the cases?
That's not true. I think they do have some issue to coordinate, because that event it's serious and it must be very careful and look at the initial stage, the coordination between the clinical, public health and officials, different agencies, it takes time. And also at that time, it's in the winter, it's a common season for pneumonia, flu. So it's mixed with different diseases have similar symptoms. Make that a distinction, it's difficult. It relies on the laboratory test. In the initial stage, the capacity for PCR test for diagnosis is limited. Only as one or two laboratory can provide that testing. Without laboratory confirmation, it's very hard to separate the COVID-19 with common pneumonia and with other flu.
Well, leader of the third expert team, Dr. Zhong Nanshan, said on January the 20th that since the 19th of 20th, they formally observed human-to-human transmission. In Chinese, 特别是昨天19号比较正式的出现了人传人的情况，还有医务人员感染的情况。What does it mean formally? Relatively formally, they have seen human-to-human transmission. Why it took so long till 19th of January?
So that is not that long. From December 31st to January 19 is less than 3 weeks. In the 3 weeks, they continue to collect data about the transmission mode. When the number of patients have no exposure to Huanan seafood market, that one single source transmission become reduced. Then they observe the more personal contact make it the transmission, particularly the special case, one special case reported by Hong Kong University about a family, 6 patient visited Wuhan. That it's first time reported the person-to-person transmission. In the local, they observed more health workers infected. Collective data suggested person-to-person is confirmed.
Let's talk about the isolation of the strain, of the virus strain. According to the white paper, on January the 1st, China CDC and China Academy of Medical Sciences received the first batch of samples of 4 cases and began the pathogen identification process. And then on January the 7th, China CDC succeeded in isolating the first novel coronavirus strain. Was it done here? What was the process like?
I think the process depends on how each of investigative team actively to collect a specimen. So in that stage, it's not well coordinated. It depends on the team's accessibility to patients. That need cooperation between investigation team, local health authority, and hospital, and the doctor take care of the patients. So all of this team, they use their access to this specimen collection. Once they get the specimen, then they do isolation. So isolate the virus, it does not mean the virus is the pathogen for the pneumonia. They still need to have the group of experts to make a joint decision to analyze the situation, look at the character of virus, compare the clinical manifestation, does that match? So after that consultation, then the expert team can make a joint decision whether or not the virus was really pathogen for the pneumonia.
So when was that decision made? When was that conclusion made? Because on January the 7th, China CDC succeeded in isolating the first novel coronavirus strain. Does that mean by then you could know for sure that this was the virus that was causing the pneumonia?
At that time, it have confidence the novel virus, it's pathogen for the pneumonia, and still the National Health Commission to call all the different teams sitting together to review the process and the finding, get a consensus for all the different perspectives. Then if all the expert team agreed, then final decision will be made.
Was that a decision by the CDC, or was that a decision by different institutions in China so that you could compare, cross-examine, and make sure that you have the best possible result?
I think it's coordinated by National Health Commission, by China CDC played a significant role, and also Chinese Academy of Medical Science, Chinese Academy of Science, also the military institute joined. So all of different teams participate in this process.
So it only took 7 days for all of these to happen?
No, they work day and night. It's 7 days. Actually, they work day and night. They worked very fast. This isolation pathogen, I think that creates a history record in the human history in terms of identify the pathogen. If we look at the history, for example, for the AIDS, so the first reported AIDS in 1981, the isolation of AIDS virus, the earliest, 1983, takes 3 years.
What about SARS? How long did it take for SARS, the pathogen for SARS, to be identified?
It took 2 months.
Took 2 months.
Yeah.
So what do you think have changed?
I think the technology development, particularly SARS outbreak, China has strengthened our capacity for all response to the emerging infectious diseases, including like this COVID-19. Previously, like avian flu, all of this has been strengthened. So that technology development also contribute a lot.
From the perspective of the Chinese government, I mean, what was the sense of urgency here?
I think a SARS outbreak, we took a lesson there. If we do not respond quickly, it will become a national disaster. So the scientists, the government officials recognize the urgency, and we all worked very hard day and night to get that done.
What was the urgency of informing the World Health Organization? Because on January the 3rd, since January the 3rd, on the regular basis, China began to update the WHO relevant countries and regional organizations according to the white paper. What's the urgency here, and what has been the CDC's role?
I think we also took a lesson from the SARS. In the initial stage of SARS outbreak, we kept the information very confident. Then the international organization worry about. One of official told me, so once you are...
So you took, in the initial stage of SARS, you kept the information confined or
confidential?
Confidential.
Confidential, very, very confidential. Public and international agency do not have access to the epidemic information. Then in the later stage of SARS, then we change it. We become transparent. We reported the case every day and change update in the morning and afternoon. For this epidemic, even we do not know the etiology, we immediately inform WHO and other countries. There are some events, pneumonia, we do not know the etiology yet, the pathogen, but we report to you and we will update the progress.
Why were you not informing the Chinese public, letting them know that possibly there is something very infectious there? Because you were talking to the WHO, you were talking to America, you were talking to experts in other countries, or authorities in other countries and regions, but you haven't really officially warned the Chinese public.
In the early stage, I think a professional communication is a different communication with the general public. When we talk with the WHO and US CDC, we are all have same background about professional training. We understand what's going on, how to respond. If this information has not conformed, released to the public, it will generate concerns and worry and social chaos.
China says it did everything possible to be transparent and timely, but there have been theories suggesting that China did not do enough, or even intentionally letting the virus spread outside its borders. What's the response from China? During our second segment tomorrow, I will find out with Dr. Zunyou, Chief Epidemiologist of the China CDC. Do tune in then. I'm Li Xin. Thanks for watching. You've got the point.